Imagine a hidden, just really agonizing condition that causes severe itching, pain, and structural scarring in the most sensitive areas of a woman's body.
Yeah, a condition that makes just sitting, walking, or intimacy almost entirely unbearable.
Right. Now imagine ditching the traditional lifelong steroid creams that people usually use to treat it, and instead shooting the delicate tissue with fractionated laser beams.
I mean, it sounds a bit like science fiction, honestly, especially when you realize that this specific treatment, the fractional CO2 laser, is being aggressively marketed across the country right now.
Yeah, they're pitching it as this revolutionary non-hormonal path to permanent symptom relief.
Exactly. It's everywhere.
Well, today we are pointing a very bright, highly concentrated beam of light directly at this topic. We're asking, can fractional CO2 lasers actually effectively treat vulvar lichen sclerosus, or VLS?
And to figure this out, we have pulled together a pretty massive stack of sources for you.
We really have. We're looking at gold standard randomized controlled trials, large observational studies, systematic reviews.
We even pulled the actual glossy marketing materials and press releases from medical clinics offering the procedure.
Right, because our mission for this deep dive is to cut through all the heavy medical jargon and, the shiny clinic marketing to find out if the cellular science actually backs up the hype.
And for you listening, this matters even if VLS isn't something you personally navigate.
Totally.
Understanding how to evaluate a highly marketed, expensive new medical technology against traditional standard of care treatments, that is a vital skill.
It's essentially a master class in medical literacy. Plus, this highlights a really fascinating, complex frontier in women's health that rarely gets the rigorous, objective spotlight it actually deserves.
It really doesn't get talked about enough.
Okay, let's unpack this. Before we can understand why someone would want a laser pointed at such delicate tissue, we really have to understand the daily reality of the disease it's trying to fight.
Yeah, and why the current standard treatments leave so many patients just desperate for an alternative.
So walk us through it. What exactly is VLS?
Well, VLS is a chronic inflammatory autoimmune condition. And while it predominantly affects postmenopausal women, it can actually occur at any age.
Wait, really? Any age?
Yeah, including childhood, actually. And it fundamentally alters the skin of the anogenital region.
Okay.
So we are talking about the formation of distinct white plaques, severe thinning of the skin, and intense chronic itching.
Which they call pruritus, right?
Clinically, yes,
Yeah.
pruritus. And the itching can be so severe that it wakes patients up from a dead sleep. It also causes dyspareunia, which is severe pain during sex.
It just sounds awful. It goes far beyond just temporary pain and itching, doesn't it?
Oh, absolutely. There are actual physical, permanent changes to the anatomy if it's left unchecked.
Like what kind of changes?
Without intervention, VLS causes severe architectural changes. The tissue literally scars over. The labia can resorb or even fuse together.
Oh, wow.
Yeah, completely altering the local anatomy and making normal physiological functions incredibly painful.
And there's a cancer risk too, isn't there?
There is. Critically, unmanaged VLS carries an increased risk of developing squamous cell carcinoma, a type of skin cancer.
Right.
Because of this cancer risk and, the severe scarring, it requires aggressive management. So the FDA-approved gold standard treatment is an ultra-potent topical corticosteroid called clobetasol propionate.
See, relying on an ultra-strong steroid long-term sounds a bit like using a sledgehammer to fix a watch.
That's a good way to put it.
It might stop the immediate problem of the inflammation, but couldn't it thin the delicate skin even further or cause other collateral damage over time?
Well, dermatologists emphasize that these class 1 ultra-potent steroids are the medical bulwark.
Okay.
When they're used consistently and correctly, they actually halt the cellular progression. They prevent that architectural scarring, and they significantly lower the risk of cancer.
But the reality of using them every day is different, right?
Exactly. The day-to-day reality of living with them is a completely different story. The adherence rates are just notoriously poor.
I would imagine applying a messy ointment constantly is a huge burden.
It is a massive lifestyle burden. Patients get incredibly frustrated with the messy application, the limited symptom relief in, refractory cases.
Refractory meaning the stubborn cases that just don't respond well.
Right. And then there's the constant fear of side effects, like the skin atrophy you just mentioned, plus the psychological weight of lifelong daily management.
So if patients are just universally frustrated with this messy, lifelong steroid cream, What happens when they walk into a clinic demanding a modern, permanent fix?
While they look for alternatives, researchers basically looked over at the dermatology and plastic surgery fields, saw them using these high-tech machines to erase wrinkles and acne scars, and decided to borrow a tool.
Enter the fractional CO2 laser.
Exactly.
But how does shooting a laser at already damaged, thinning tissue actually heal it? I mean, that seems counterintuitive.
It operates through calculated controlled destruction.
Controlled destruction.
Yeah. Historically, CO2 lasers were used in cosmetic surgery to resurface the entire face by essentially burning off the top layer of skin.
Yikes.
Right. But the technology evolved. The modern CO2 laser operates at a very specific wavelength, 10,600 nanometers.
Why does that specific number matter?
Because at that frequency, the light specifically hunts down water inside your cells.
Oh, interesting.
Yeah, when it hits the tissue, it penetrates about 0.5 millimeters deep and instantly vaporizes the intracellular water. This creates highly controlled thermal damage.
Okay, and what does the fractionated part mean in practice?
So instead of a solid beam of light vaporizing a whole sheet of skin, the beam is split or fractionated into tiny 200-micron dots.
Or pixels, right?
Yes, pixels. Imagine a microscopic grid. It zaps these tiny dots into the tissue, leaving healthy, untouched tissue all around each microwound.
Okay, so it's not burning everything.
No, just the dots. And this localized heat shock damages signaling cytokines, which are basically the chemical messengers in the body that shout at the surrounding tissue to stay inflamed.
Oh,
It forces those chemical alarms to reset, and it breaks down the old, scarred collagen matrix.
so it's basically like aerating a lawn. You punch tiny controlled holes into the turf so water and nutrients can get in, forcing the whole yard to grow back thicker and healthier without actually destroying the grass itself.
What's fascinating here is how that lawn aeration process, on a cellular level, tricks the body's natural repair matrix into high gear.
How so?
The thermal damage acts as an urgent alarm bell. It recruits fibroblasts, the specialized cells that build the structural framework of our tissues.
Okay, so the builders come in.
Exactly. And this stimulates the biosynthesis of brand new, healthy collagen and elastin. It also promotes neovascularization.
Which is new blood vessels.
Right, the growth of new blood vessels to nourish the area. It essentially forces the skin to remodel and regenerate itself from the inside out.
Now, our sources also mention other types of lasers being tested, like the NDYAG laser. How does that compare?
The NDYAG operates at a different wavelength, around 1,064 or 1,320 nanometers. It penetrates much deeper, about 3 to 4 millimeters.
So a lot deeper than the 0.5 millimeters of the CO2.
Exactly. It targets hemoglobin and deeper blood vessels rather than just surface water. But the CO2 laser keeps the thermal spread tight and superficial right at that 0.5 millimeter mark.
Which is right where the VLS lesions are.
Right, exactly where the superficial inflammation is located.
Okay, so the biological theory makes perfect sense. Aerate the lawn, reset the chemical messengers, force it to grow back healthier. And when clinics actually started using this fractionated CO2 laser on real patients with VLS, the early data we gathered looked incredibly promising.
The initial observational data was very strong. For example, there was a prospective observational study published in the journal MDPI. It tracked 75 women with refractory VLS.
So the women who weren't responding to steroids anymore.
Right. And after just 4 laser sessions spaced a few weeks apart, they saw massive drops in pain and itching.
I'm looking at these numbers from the trial right now, and they are surprisingly high. What exactly changed in their daily lives to warrant these scores?
Well, they used the Dermatology Life Quality Index, or DLQI.
Right, and their scores dropped from an average of 10.72 down to 5.94. In the context of that scale, that means their symptoms went from having a, quote, very large effect on their daily life to just a moderate effect.
Which is huge for them.
Yeah, imagine going from constant daily distraction to actually being able to forget about your condition for hours at a time. And their sexual function scores, the FSFI, jumped from 10.48 up to 15.52.
We also have the Burkett randomized controlled trial, which directly compared the CO2 laser to the gold standard clobetasol steroid cream.
Oh, a head-to-head comparison. What happened there?
At the 6-month mark, the group that received the laser treatment showed greater improvement in subjective symptoms. This was measured by the Skindex 20 non-survey, and they reported much higher overall satisfaction with the treatment than the steroid group.
Naturally, medical clinics took this data and just ran with it, looking at marketing materials from clinics offering this, like Women's Excellence, for example. They are aggressively promoting the CO2 laser.
Oh, absolutely.
Their press release calls it a quick in-office procedure that provides rapid results and minimal discomfort. They frame it as a complete paradigm shift, a modern escape from the burden of daily steroids.
It paints a very compelling picture for someone suffering from a chronic condition: high patient satisfaction, visible improvements in tissue elasticity and color, and freedom from those messy ointments.
Here's where it gets really interesting, though. If the patient surveys are this glowing, and clinics are boasting hundreds of successful procedures with zero major safety events, why isn't this the official, universally recommended gold standard right now? Is there a catch to these glowing, self-reported surveys?
Well, if we connect this to the bigger picture, we really have to look at observer bias and the placebo effect.
The placebo effect.
Yes. When a patient who has been suffering silently for years suddenly receives highly attentive care, placed in a modern clinic with a futuristic, expensive machine and a doctor dedicating significant time and touch to them, their subjective perception of their disease can change dramatically.
Wait, you mean the simple act of receiving attentive high-tech care physically reduces their perception of pain? How does that actually work on a biological level?
Pain and itching are highly subjective experiences processed by the brain. The placebo effect isn't just, in your head, it's a physiological response.
Really?
Yeah, when the brain expects healing, it can trigger the release of endogenous opioids, the body's natural painkillers.
Oh, wow.
It can also modulate descending pain pathways in the spinal cord, literally dampening the nerve signals that transmit the sensation of itching before they even reach conscious awareness.
That is wild.
So, while their physical experience of pain genuinely decreases, that does not necessarily mean the underlying cellular disease is actually being cured. To prove that the laser is modifying the disease itself at the cellular level, you need a different kind of study entirely.
Which brings us to the plot twist in our deep dive. To find out if the laser is a true cellular cure or an incredibly high-tech placebo, researchers conducted a rigorous, double-blind, sham-controlled trial.
Yes, the Mitchell et al. Study.
And the results completely upend the narrative.
The Mitchell trial is absolutely vital for medical literacy here. They took 40 women with VLS and split them into two groups. One group got the real fractional CO2 laser treatment.
Yeah.
The other group got a sham laser. It was a completely fake treatment where the machine sounded exactly the same, the timing was the same, and the probe was used, but no actual laser energy was delivered to the tissue.
And because it was double-blind, neither the patients nor the evaluating doctors knew who got which treatment.
Right.
Let's look at the subjective results first, what the patients actually felt. The group that got the real laser reported a 6.82-point improvement in their symptoms. But the group that got the completely fake laser reported a 4.83-point improvement.
It's staggering.
The sham treatment almost matched the real laser in making people feel significantly better.
And this is where it gets critical. The primary outcome of this study wasn't a subjective survey, it was the histopathologic scale.
Meaning they looked at the actual cells.
Right. They took actual physical biopsies of the tissue before and after the treatments and looked at the cells under a microscope to see if the disease pathology was actually healing.
And what did the microscope show?
There was zero statistically significant difference in tissue healing between the real laser and the fake laser.
Zero difference.
None. The cellular pathology of lichen sclerosus, those deep inflammatory markers, was identical in both groups. Furthermore, when clinicians did visual scores of the tissue, the active laser group actually worsened slightly compared to the sham group, likely due to the mechanical trauma of the laser itself.
So what does this all mean? I have to challenge this a bit, just from a patient's perspective.
Sure.
Even if the tissue didn't change under a microscope, if I am feeling significantly less pain and itching, even if it's via a placebo mechanism from a fake laser, altering my spinal cord signals, isn't that still a massive win for my daily life? Why wouldn't I take that relief?
This raises an important question, and it is the exact crux of the debate in gynecology and dermatology right now.
Right, because feeling better is the goal, isn't it?
Symptom relief is wonderful, yes. And improving a patient's daily quality of life is a major clinical goal. But remember the silent long-term threat of VLS.
The scarring and the cancer risk.
Exactly. It leads to permanent anatomical scarring fusing of the labia, and it significantly increases the risk of squamous cell carcinoma.
The cancer risk is the underlying danger.
And those topical steroids, as messy and frustrating as they are, actually penetrate to the cellular level to halt that progression and lower the cancer risk.
Right.
The laser, according to the Mitchell trial histology, does not modify the underlying disease. Treating VLS only with a laser because it makes the itching stop is like painting over a deeply rusted car frame.
Ah, I see.
It looks better on the surface, and you might feel much better driving it, but the structural danger is still growing underneath, completely unchecked.
That is a terrifying thought if you're abandoning your steroid creams thinking a $1,000 laser package cured your autoimmune disease.
It really is.
So, if the CO2 laser isn't this standalone magic bullet, but it clearly helps some patients feel better, physically or psychologically, where does it fit into the future of medicine?
Well, the field is evolving toward finding a highly specialized sweet spot through combination therapy. The sources reveal a wave of ongoing clinical trials that are testing the laser not as a replacement for traditional medicine, but as an adjunct, as a strategic add-on.
Like using the laser alongside the clobetasol.
Exactly. Studies are showing that combining the CO2 laser with topical steroids, or even topical estrogen, yields fantastic comprehensive results.
How does that work together?
The laser mechanically remodels the superficial tissue, breaking down surface scar tissue and providing that immediate symptomatic relief. It improves the skin's elasticity, which massively increases patient morale.
That makes sense.
Meanwhile, the steroids are doing the heavy lifting on the cellular level underneath, suppressing the autoimmune response and preventing the cancer risk.
They are also getting highly creative with how they deploy these tools, too. I saw deep dives in the trials discussing combining the CO2 laser with platelet-rich plasma, or PRP.
Oh yeah, PRP is a fascinating biological booster.
How did that work?
They draw a small amount of the patient's own blood, spin it in a centrifuge to isolate the buffy coat.
The Buffy coat.
Yeah, which is the layer rich with concentrated platelets and growth factors.
And then they apply that plasma directly to the tissue right after the laser treatment.
Yeah, precisely. Because the laser just created thousands of microscopic microchannels, those aerated holes we talked about, the PRP can penetrate deeply into the tissue.
Oh, so it just absorbs right in.
Right. The concentrated growth factors supercharge the healing process that was initiated by the laser's thermal damage.
There's also the exploration of dual laser therapies in the sources, combining the deep penetrating ENDA-YEG laser with an ER-YAG or CO2 laser to hit different tissue depths simultaneously.
Right, covering all bases.
Yeah, the CO2 laser handles the superficial epidermal remodeling, while the ENDA-YAG reaches down 4 millimeters to tackle deeper vascular inflammation.
The technology itself is brilliant, and the physics are totally sound. It is just a matter of clinical researchers learning exactly how to deploy it safely and effectively without giving patients a false sense of security.
Let's bring this down to earth for the listener. If you are a patient navigating this exact diagnosis right now, and a clinic offers you a laser package promising to cure your VLS and free you from steroids forever, what is the grounded scientific takeaway from all this research?
The grounded takeaway is that the fractional CO2 laser is a highly promising adjunct therapy. It is a fantastic option for refractory cases, people whose intense itching and pain just aren't fully controlled by steroids alone.
Right.
It can greatly improve your quality of life, your sexual function, and daily comfort. However, it should absolutely not replace your topical corticosteroids as a standalone treatment. Not until long-term, objective histological data, actual biopsies, prove that it stops the cellular progression of the disease.
You have to treat the rust, not just the pain.
Exactly.
So, to wrap up our deep dive today, the fractional CO2 laser is an undeniably fascinating medical innovation. It mechanically stimulates tissue repair by essentially aerating the skin and forcing the body's natural matrix to rebuild.
Right?
But while observational studies and patient satisfaction scores are sky high, rigorous sham-controlled trials prove it isn't quite the cellular cure-all that some clinics market it to be. It is a powerful tool, but currently it is best used as a team player alongside traditional disease-modifying medicine.
And this perfectly illustrates why true medical literacy means looking past subjective symptom scores and glossy marketing brochures.
Absolutely.
It means understanding the difference between feeling better and actually healing, and demanding objective histological evidence before ever abandoning a proven standard of care.
Before we go, I want to leave you, the listener, with a final, slightly provocative thought to mull over on your own. Let's think back to the mechanics of that Mitchell sham trial.
Right, the fake laser.
Yeah. Patients who received a completely fake laser treatment still reported a massive life-altering reduction in severe chronic pain and itching.
It's incredible.
If the human brain can trigger endogenous opioids and modulate spinal cord nerve pathways to generate that profound level of physical relief, simply because the patient believes they are receiving advanced, high-tech care, what does that reveal about the profound deeply untapped power of the mind-body connection in healing autoimmune diseases.
It really forces us to reconsider the boundaries of how our perception literally shapes our biology.
Thanks for taking this deep dive with us.